Hello friends. In this video, we are going to discuss about what are the differences between dialectical behavioral therapy and cognitive behavioral therapy. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. In this video, I'm going to discuss the differences between cognitive behavioral therapy and dialectical behavioral therapy. The video is targeted to psychiatrists, registered medical practitioners, nurses, mental health professionals, psychotherapists, and counselors. Cognitive behavioral therapy was developed by Aaron Beck, and he developed two important things: cognitive therapy and cognitive behavioral therapy, which has been very useful since 5 decades, and it has been used across the worldwide, and the researchers are pouring with regard to cognitive behavioral therapy. But however, Marsha M. Linehan came up with a modified form of cognitive behavioral therapy considered as dialectical behavioral therapy. And she learned this dialectical behavioral therapy because she was treating patients with borderline personality disorder with CBT. But CBT fell short of it. CBT could not handle the patients with borderline personality disorder, patients who had high suicidality or deliberate self-harm. Hence, the dialectical behavioral therapy became the main goal or main treatment modality for those patients. So let's discuss about cognitive therapy versus DBT. Although DBT borrows certain concepts from cognitive behavioral therapy, but however, it deviates from CBT in certain aspects. Let's discuss that. Cognitive therapy is loaded with cognitive therapy and behavioral therapy, whereas dialectical behavioral therapy has two important theories. Apart from cognitive therapy and behavioral therapy, it also has dialectical theory and biosocial theory. Dialectical theory means basically both the therapist and clients have their own extreme way of thinking. The therapist will have a rigid, this is the best way to do, whereas the client thinks, no, this is the best way to do, or his thinking process. Now, you both of them need to accept each other's ideas and come to a commonality. That acceptance and coming the mid pathway is dialectical theory. Moving to biosocial theory. Biosocial theory is a combination of genetic vulnerability of being emotional sensitive, that is, amygdala is very, very sensitive, that is in the brain, and because of the environmental invalidation, that means parents are invalidating the children. So that is biosocial theory. That is where borderline personality disorder and various psychopathologies are developed. This is the first difference. Coming to the second. In cognitive behavioral therapy, very often therapists will saying, your thinking is wrong. You have cognitive errors. You have cognitive schemas. You have automatic negative thoughts. Here, the blaming or shaming of the patient occurs in cognitive behavioral therapy. But whereas in dialectical behavioral therapy, it clearly says that it's genetic vulnerability. It is the environment which is creating trouble to the client, and at the same time, the client has emotional dysregulation. Here, it is not the blame on the client. Here, it is the acceptance of the client. That is dialectical behavioral therapy. The complete wrong is there with the client in CBT, whereas in DBT, there is nothing wrong in the client. The client need to learn how to deal with the harsh environment. Hence, the skills are taught in dialectical behavioral therapy. Moving further, in cognitive behavioral therapy, they talk about cognitive triad, schemas, distortion, and ENT. DBT is based upon two important concepts, which I said acceptance. You are going to accept the client the way he is. At the same time, you'll teach the client to accept himself the way he is or she is. That means you need to teach the client, yes, you have this problem. Accept yourself first, rather than blaming or telling something else. Once you have accepted, now you need to move from this position where you are suffering to a place where you will be comfortable. That is the growth. That's where the DBT comes into picture. Cognitive behavioral therapy was started for basically depression and then moved into anxiety disorders and various other psychiatric illnesses. But however, DBT was focused for borderline personality disorder, suicidal patients, and deliberate self harm. In CBT, it is focusing on thinking and behavior, whereas in dialectical behavioral therapy, it is emotional dysregulation and interpersonal dysfunction or dysregulation, you can call it as. Further, in cognitive behavioral therapy, you will be searching for cognitive errors or thinking errors, you will be searching. Whereas in DBT, you are not searching for any flaws in the patient. You are looking for acceptance of the client, validating the child experience. That means validating the person's experience and helping him to grow by teaching him certain skills. As I mentioned, cognitive behavioral therapy is by Aaron Beck and the biosocial theory by Marsh M. Linehan. So these are two important things you need to understand. And CBT is completed over a period of 3 months. Invariably, 20 to 26 sessions are required. Whereas in dialectical behavioral therapy, usually the therapy runs for 1 year, and which may have 40 to 48 sessions of individual therapy and also 40 to 48 sessions of group therapy will be there. So that means DBT requires more number of sessions and the duration is 1 year. Here, CBT is cognitive focused and DBT is emotional focused. Hence, you need to teach certain skills like mindfulness skills, emotional regulations, crisis tolerance. Further, CBT is highly judgmental. DBT is non judgmental. You need to accept the client the way he is, and at the same time, you need to teach the client to accept himself. CBT is more of protocol driven. This is the way you have to do, whereas dialectical behavioral therapy is based upon certain philosophy and it is principle driven. Here in cognitive behavioral therapy, it is either done as individual therapy or else group therapy. Whereas in dialectical behavioral therapy, it is a must hybrid mode. That means here the client will go through individual therapy, group therapy. He will be given telephone counseling, also coaching. And further, in DBT, the therapist also need to undergo certain training and support in DBT consultation team. In CBT is highly structured sessions, whereas DBT is very flexible. Here in CBT, you do restructuring of the cognitions, whereas in DBT, you are going to do emotional regulation and interpersonal dysfunction correction will be done by teaching certain skills. Here, individual therapy or group therapy sessions are common, whereas in DBT, as I mentioned, hybrid model sessions will be done individual therapy, skill training group, telephone consultation team, and invariably each session will be 45 to 60 minutes, whereas in DBT, the individual sessions last for 60 minutes per session, whereas in group therapy, it is 2 to 3 hours per session. And there are certain modified CBT. Similarly, there are some modified DBT also is available. And here in cognitive behavioral therapy, one or maximum two therapists. In dialectical behavioral therapy, you need to have group of therapists. Invariably, the prime therapist will be one. There will be co-therapist. There are skill trainers, telephone counselors, yoga teachers, maybe mindfulness trainers will be available. In CBT, there will be one supervisor, whereas in DBT, there will be a consultation team where the therapist will meet weekly once to discuss and will discuss about his problems in dealing with the client. At the same time, to remain in the DBT framework, he will take help from the team and also he will be getting feedback from other members. And you need to understand therapy or theory of DBT based upon cognitive behavioral therapy, and it is evolved during borderline personality disorder treatment by Marshall Linehan. Skill is evolving that has to be clearly understood by the client and the therapist also, and there is a need for non-judgmental accepting of self by the client and also by the therapist. Whereas in CBT, you're going to say you have certain distortions or you have some schemas or ANT. Whereas in DBT, it is not. You are going to accept the client the way he is. Here, once you are accepting, the next step is, yes, I've accepted you. I know you're going through these difficulties. Now we need to move from these unpleasant surroundings to the pleasant surrounding. That means moving from the painful situation to the place where there is less pain. That is where we call it as teaching skills to move from painful situation to the happy situation. That means improvement is essential. That means here you are going to teach them from moving from extreme thinking to the moderate thinking. That is what is dialectics all about. To conclude, my dear friends, DBT is well studied psychotherapy, and it is initially focused on borderline personality disorder and suicidal risk patients. But now DBT has been used in various other conditions like eating disorder, borderline in bipolar disorder, in various other condition it has been used. And here the focus is on emotional dysregulation, and also interpersonal skills needs to be taught. And here not only it says that the client requires support, but also the DBT therapist, the primary therapist, also requires support in DBT consultation team. That is the way it is. Hence, Marsh and Linehan clearly says that if there is no DBT, if there is no DBT consultation team, that means no DBT should be done. That means no DBT without team. What a beautiful way of putting across. That means here in DBT, the DBT therapist is not alone. There is a team of the skill providers. At the same time, there is a DBT consultation team which is going to assist, help, support the therapist. Thank you very much for giving your valuable time. Stay safe.